Good morning. Can you please introduce yourself to the audience for me?
My name is Vanessa Vaca.
And you work for the Los Angeles County, correct?
Yes, I work for the County of Los Angeles Department of Mental Health.
And what programs do you work with over there?
I work over the Children's Systems of Care Administration, and we have many programs there, but I'm specifically over the Birth to Five program, and we provide all the administrative oversight for all the programs in the County of Los Angeles that provide mental health services to children in this age population.
What kind of administration oversight do you guys offer to this program?
We provide any kind of utilization oversight, such as monetary, fiscal oversight. So if any of our 55 or plus providers request or seem as if they need more funding for their programs for our age population, which again is birth to five, then we examine their utilization. But not only do we look at that, we provide an allocation for a training budget for them, because there's a lot of need for children in this age group, also because they are mostly attached to DCFS kids, which is Child Welfare Division.
By attached to DCFS kids, do you mean that they themselves are DCFS kids?
Yes, they have an open case with the Department of Child and Family Services while they're receiving services, any kind of mental health services.
What kind of mental health issues are most common with this crowd that you work with?
It's more of an attachment issue, but I'm not a clinician, so I wouldn't be able to answer that as far as what specific mental health issues. I can tell you the cost per client, which ranges from $8,000 to $13,000 per child, depending on the services they're receiving. But as far as what kind of mental health services, I don't have that right now to give you.
Okay, that's fine. Thank you so much. And also, now what do you find is the hardest part of your job?
Well, for working for a government entity, it becomes very, very difficult to work with all the bureaucracies we have in place. Although there's pros and cons to having a bureaucratic system, which would mean like the checks and balances of how we select our providers to give money to. So I would have to say it's just having to deal with all the people that are involved in all the departments within our own department. So for instance, if you were a provider and we wanted to give you money, it would be very difficult to give you more money because it would take us months. We have to possibly, depending on the transaction, we would have to go to the Board of Supervisors, get authorization. So there's a lot of checks and balances, which is very time consuming. So that's a little bit of frustrating, but at the end of the day, we're helping children out and we're helping families, and that's what our mission is with the Department of Mental Health.
What do you feel is the most rewarding aspect of your job? And also, have you ever had a one-on-one experience with someone personally thanking you for all the work that you do?
So the most rewarding thing would be basically what I mentioned prior, is that helping families and knowing that we do make a difference, even if some children receive different services than others. But our objective is to go ahead and help families and provide our children with services that they would not have been able to receive if they did not have good providers like within the County of Los Angeles. And yes, I have been thanked by not only families, but providers as well, for just being that middle person from the Department of Mental Health and just trying to streamline things as quickly as possible for them to be able to provide services. Because a lot of times these providers are running on $0 or, on minimal funds, and they have to wait on our bureaucracy, our system to go ahead and give them the money to then provide these services. And a lot of these times, these children are facing a lot of traumatic experiences. So there's no room for waiting and waiting, and unfortunately, that's a lot of the time the families have to just wait. Therefore, the provider has to wait, and it's just a trickle down effect. But I have been thanked by our providers in different platforms, whether it's a training or it's just a call, and I've been asked, I've been thanked very much for just my participation in all of this.
What is the biggest struggle that you have faced personally while dealing with this bureaucracy system and the system of checks and balances and things like that? And have you ever run into any personal, difficulties when dealing with it, when trying to apply to get more funds for a program or something like that?
The only thing I could think of that is it's not literally I guess it could be personal, but just because of the fact that communication is a major component of getting things done in any type of organization, whether it's government or nonprofit or for profit. You're dealing with different types of personalities, different work ethics. So a lot of times we obviously have to work in collaboration with not only people outside of our department, but inside our department, and then take into consideration um, their work ethic. So, for instance, if something's contingent on my provider getting any kind of funds or attending a training or whatnot, I have to provide a submission to the training division. Then the training division has to go ahead and go to their supervision. Then the supervision has to go to our director to make sure that basically we're not just being completely subjective when we're choosing who's going to get this money, this funding, this training. So there's a lot of checks and balances that take place. But not only that, but just working with these other divisions, these people sometimes are not, let's just say, forthcoming and working quickly or trying to make things happen so they can sit on something, or maybe it can be perceived as sitting on something when they're just doing the best they can on their end. But it's just working with different personalities that becomes very difficult sometimes.
But do you believe that the checks and balances system works out for the best in the long run with these programs that you work with in the county and Department of Mental Health?
Definitely. There always has to be some kind of system in place for checks and balances, especially when you're working and dealing with tax-paying dollars. However, I think that there's still always room for growth on making it a seamless transition or transaction, because it does take a lot of time to get things done. And unfortunately, a lot of government agencies get a bad rap for that. And sometimes our family or the people that we're serving, whether it's a parks and recreation, whether it's beaches and harbor, whatever or department it is, but something always has to give. But definitely the checks and balances has to take place.
What other programs within the county or other positions have you held within the county and the Department of Mental Health that made you qualified for this job and working with these programs and so hands-on and things like that?
So I'm currently an analyst, and with the county, it could be a different title, but basically it's analyzing, it's recommending, and it's working with higher management. And prior to this, I have worked in the jail systems as a medical caseworker, working directly with clients and administration, collaboratively, trying to go ahead and bring other programs into the jail to help address the jail recidivism rate. I've worked with the Department of Justice in there as well. In addition to that, I've also worked with the Housing Policy and Development Unit, which is working on grants and developments, basically with the bricks and mortar system, giving the funding for the bricks and mortar, which is the actual housing complexes for our mentally ill clients throughout the county of Los Angeles that are homeless. And that is another program there in the housing unit that I worked with was in the Shelter Plus program, and that was doing audits with all throughout the county of Los Angeles, different shelters that had that received funding or had contracts with the Department of Mental Health, and just going out there and auditing, making sure that there was no abusing, and that all our clients were receiving the services that they were in fact being responsible for per their contract.
Okay, Vanessa, and for my last question, I know that you have 4 children, and I was just wondering, in your experience, do you ever feel emotionally attached to the cases, or do you know of your coworkers who ever feel emotionally attached to the cases and find them difficult to work on? And if it's a common issue for those who have personal relations to, these children who, not personal relations, but just can relate to these children, if that makes any sense, who have, mental illnesses or emotional illnesses that you're working with, or are living in impoverished lives and things like that, if it ever gets difficult for you.
So, working in any type of environment when um, your job requirement is to assist families, whether it's, sons of families that are in jail, or if it's, veterans that are homeless, or if it's children and their families that are homeless, it's always going to impact you regardless of where in the organization you are placed to work. So, because I mentioned prior that I'm not a clinician, but I have always worked with programs, and even in just the clinic settings, or literally geographical area of outside my office, of seeing the impacts of our society, and the being able to see exactly the population that we serve, regardless of age group. It always draws down on you emotionally, and we in the department know it as compassion fatigue and just burnout. So it's very important, and the beautiful thing about the County of Los Angeles Department of Mental Health is they do offer some trainings for us, for our staff, for our providers, to combat the compassion fatigue for any kind of burnout. Unfortunately, it still takes place, but there are some resources that we do have, and these involve a 1 day, a 2 day, a 3 day, sometimes even a 5 day training throughout the month. Not all, consecutively. It just varies, so that we have resources in place, because we do have families. We are human beings, and we do take this home to our children, to our spouses, to our families, and to our core. But just like with everything else, we are there for, a purpose, and it's to assist people. And unfortunately, there's a lot of burnout in this department, and also with working so closely with Child Welfare Division. But yes, we definitely take it home, and that's why you have to have a very good system in place of family life, and a good spiritual strength and stuff to go ahead and combat that. And it also assists when you have a wonderful administration or supervisor in place as well, where they're understanding to this. And sometimes it's very, very necessary to even take a mental health day, whether you work in mental health or you don't. So I think it's very, very important and applicable.
Of course. Now, thank you so much for answering all my questions, Vanessa. I really appreciate it. Um, I hope you have a great day, and thank you so much for cooperating with me and answering all my questions about the mental health programs that you work with within the County of Los Angeles.
You're very, very welcome.
Okay, thank you. Have a great day.
You too.